2, 1. All right, hi everyone. It is April 18th, and I'm here with Dr. LJ Shipley, coming to you from our homes as we practice safe social distancing. And yes, April 18th, it's a Saturday. To get time with Dr. Shipley is a very precious commodity, as she is working so hard day and night, but coming to you today with a very important message, and that is for the primary care of kids and families in our community that looks, maybe different, very different than it did a month ago. So what does primary care look like these days?
So Jennifer, thanks for meeting me on a Saturday morning. I think that primary care looks really different right now, but all of the things that are important about primary care are still happening. And so I just wanted to let people know our primary care practices, your teams, your pediatricians, your family physicians, your nurse practitioners, and the nurses and all of the teams in their offices, they are open, they are working and ready for you. It just looks different right now. Many of you experienced, those of you who had visits scheduled in March and April, and maybe even early May with your doctor's office may have been canceled. Those visits might have been canceled or postponed. And there was a good reason for that. All of us in medicine are trying to practice and reinforce I know it's called social distancing, but honestly, I really prefer physical distancing because I really think to say we're socially distanced is sad. But I think that they were really trying to promote and are trying to promote that physical distancing. So very quickly, right at the beginning of this in March, over a month ago, practices began to think about what are the absolute essential visits that can't be postponed, that can't wait for a month perhaps, or for 6 weeks. And so some of those are babies coming right out of the hospital. All of our young children, our youngest children, our 2-month-olds, our 4 months, 6 months, 12 months, the 15-month-olds and the 18-month-olds and the 2-year-olds. Those are critical times where so much is happening for children. Their brains are growing in incredible ways. They need protection and prevention strategies. They need immunizations. They may need screening for lead risk. And they actually need a physical exam. They need to be seen and actually examined at that time. And they're too much is changing in that window to postpone. So that was some of what we talked about as essential visits. And it doesn't mean that other things are not essential, they're critical. But I'm happy to say that as we go forward, more and more of the routine, the things that people call well child visits, the preventive visits, are going to be opening back up to be able to be done in your doctor's office. And they're being able to do that because they can do that safely. Mm-hmm. So you mentioned that, people are doing different things. The strategies and the improvisation and the smart things that people are doing to keep patients safe and families safe and not exposing them unnecessarily to coronavirus or other illnesses is really cool. I mean, from you waiting in the parking lot till your doctor's office calls you, like buzzing you like your reservation is ready, to coming out to your car to do certain things, to do, if you've got a child who's sick, and for many of our illness visits, we have to see you. We can't diagnose what's going on without a visit. But people have been really creative about that, even doing a strep test, through the window of the car, if need be. And I think there are other things that look different in terms of the care. All of our practices are utilizing more telephone and definitely telemedicine or televideo visits. Mm-hmm. We really want people to feel comfortable with that. It's just like this. This would not be my way I would want to interact with you, Jennifer. I'd love to sit next to you and talk. Uh-huh. But this is so much better and more effective than necessarily a phone call would be. We've got some families who don't have access to the video opportunity. And if you don't, and you're reaching out to your doctor's office, they're reaching out to you, let them know. Because we're also really trying to figure out strategies to get people access to that connection.
I'm hearing this theme of communication. Things did clamp down for a while, and then our inboxes, filled with so much. So just if there are correspondence from your doctors, you maybe don't let that just sit in your inbox. Pay attention to those, it sounds like, because again, some of these visits really can't be missed. And, while we're thinking about checking in with our doctor's office, and yes, we were talking about certain things that we can't skip. It is this two-way communication of people want to say, hey, we're a month into this now. How are you doing? Because you guys have great resources that could help us. If I could say, you know what, I'm having a tough time with this, right?
Yeah. I think that there's a term that's used, whole child health or biopsychosocial health care. And what those terms mean is like, health is way more than how your body is doing. It's way more than just the biology of health. It's your emotions, it's your feelings, it's how you're connecting. I talked about like a hate social distancing term, because more than ever now we need to be socially connected in some way with those around us, with our support networks, and our kids need that too. So I think that I would love for people to feel comfortable to reach out to their doctors. And I know that your doctors feel that way, and their staff do. If you are struggling, if it's not just a physical question or a health question that way, everybody's experiencing stressors and changes, and they're having to learn new coping strategies, use ones that are maybe different, or maybe use their original coping strategies, even more. And I know our schools are doing the same thing. Our child care centers are reaching out to families that they have relationships with to check in with them. And those check-ins are really, really key. Those conversations are so important.
For the teenagers too, we haven't really mentioned the teenagers yet. Important to find a trusted adult outside the home.
Yeah, and that's a really important thing, Jennifer. I think that we've had other videos that have talked about things you can do with little kids and what teens need. Sean Nelms did a great spot on that. But, from a pediatrician standpoint, I just want to encourage parents to realize that teens need trusted, caring adults that are outside of their parents. I am a parent of teenagers right now, and one of the things that we've started to do is really facilitate for our kids the opportunity to connect with family members, like their uncle or their aunt or their grandma, or teachers or coaches who they have really trusted relationships with, and also their doctors. So I think that those conversations need to happen. They need to happen between the teen and that person. And I just looping back to what we talked about, essential visits. There are teen visits that are definitely in that essential visit category. There are things that we need to be able to talk with and do for our teens, or for kids of other ages that have to be done in person. So I think the message I really want is for people to trust this strange and evolving process. Your doctor's offices are open and they're there. They're ready for you. They're not going to have you come in if you don't need to, but they're going to assure that if they tell you that they can see you in person, it's going to be safe. They're all going to be masked, which is really important. And most of us just hate it, but it's really important. It needs to be done. So I remind you to, prep your kids for that, and remind them to look in people's eyes, because I miss smiles and the ease of communication. You put this up, I'm not touching my face, but you put this up, you lose something in communication.
Right.
But watch. But when I smile,
you can still see it.
Yeah, because I got wrinkle lines, but lines. No, but you can see it, and I think reassuring kids that's okay. And I think the last message I would just say is just like, be gentle with yourselves, be gentle with your kids, stay curious. As a parent, I'm being asked to help with with calculus and with earth science right now, and I don't know that stuff. I don't know it. And I am very intimidated about that in some ways, but to tell my kids, I don't know. Let's be curious. Let's figure that out together. Hug your kids as long as you're not sick. Hug your kids, hug your dogs, and stay connected. Reach out to your doctor's office. This pediatric community, all of it, the primary care docs, all of our team at Golisano Children's, the specialists, everybody is there to take care of and protect our community. And we're really fortunate in that way. And we are totally going to stay physically distanced for a little longer, but socially connected.
It's amazing to see all of this come together. You've been an incredible leader of this behind the scenes movement, but this message that you're sending out to everyone, so vitally important. We appreciate your time. Enjoy your Saturday.
You too. Thank you so much.
Bye-bye.
Bye.